Good evening once again, Dr. Martin. Good evening and welcome to CWS.
Thank you so much. How are you?
I am fine, thank you, Dr. Martin.
Great. Well, I must say how much I admire the work you do.
Thank you.
Bringing knowledge and information to the people. You know, the scriptures say in Proverbs that in all our getting, we should get understanding. And that's what you do. So you're doing God's work. Thank you.
Thank you so much, Dr. Martin.
You're welcome.
Dr. Monica Martin is an obstetrician gynecologist in New York. She received her medical degree from State University of New York, Downstate Medical Center College of Medicine, and has been in practice for 37 years. She's also an acupuncturist and practices traditional Chinese medicine. Dr. Martin, you're here this evening to talk to us about hormonal system, women hormonal system.
Yes, Selwyn. You know, we picked a very broad topic. The hormonal system in general for both men and women is very vast. The hormonal system for women by itself is very vast. So in 30 minutes, if you want to ask me questions or you want me to just talk to you a little about what, you know, give you a little general information about the endocrine system, we can do that.
Well, I'll ask some questions and then we'll mix it up.
You'll mix it up. You know. Okay. Yes. So, you know, the endocrine system, or otherwise most commonly known as the hormonal system, as I say, in both men and women, is a system that comprises of multiple glands that are situated in different parts of the body. It starts with the brain. We have quite a few endocrine organs or hormonal organs in the brain. We have the hypothalamus gland, we have the pineal gland, we have the pituitary. Those are all in the brain. I mean, we have the thyroid gland, which is very important, the pancreas, which is what has to do with diabetes and insulin. It just goes on and on. We have the pineal, which is another gland that's in the brain. And so each one has their own job that they do for the body. And it's always fascinating to me to see how organized these organ people are.
You call them organ people. What was it? What was it like for you the first time you got introduced to the endocrine system?
The first time I got introduced to everything in medicine, I was with my girlfriend, Crystal. We were study partners, and we just used to enjoy our work, our knowledge so much, and we used to make fun with it. We used to make songs with it. We used to be just totally fascinated by the human body. And sometimes it offends me when people call people like us geeks and those kind of words, because I find that if you get to know the human body, it is so extremely fascinating. And every one of us has a body, so we should all know about it. But I had a lot of fun learning about the endocrine system, and I was very, very fascinated with it.
What is important to know about the female hormonal system and aging?
Well, the female hormonal system from birth to aging to the end of life they're all very important. But since you ask about the aging, a lot of the knowledge that, for example, I'm not an endocrinologist per se, but we know we all doctors have a lot of knowledge. And I don't think the average patient needs anything close to that. But they should at least get an understanding of how their body works, get an idea of it. For example, aging, you know, we're talking about a woman who has probably reached the menopause or about to reach it or has passed it. She needs to know what to expect. And it's the panic that sets in when people see certain things happening to their bodies because they didn't have a clue it was going to happen. A lot of people don't ask their doctors questions because they say the doctors don't have time. But I'm sure if you call your doctor after hours, leave a message, most of them will call you back. Mm-hmm. So basically, a woman needs to know, for example, that as I spoke about before, the hypothalamus gland in the brain, that structure sends message to the pituitary gland, which is also another part of the brain. Tell the ovaries what to do. I mean, they give each other orders. The difference between them and us humans is that they listen and they obey. So the pituitary gland has to shut down the ovary under the orders of the hypothalamus gland. And when the ovary is shut down or is close to being shut down, in other words, no more estrogen is being produced, the ovarian follicles are getting less and less, then the woman starts to get certain symptoms, and some symptoms may frighten her. Most people hear about hot flashes, so that may not frighten her, but when you have something like heavy bleeding just happening to you, memory loss, if you're not on any kind of replacement hormones, then if you have knowledge, then you'll kind of know how to deal with it. If you have no knowledge, you'll panic, and then you'll run to the emergency room and get a DNC and another DNC and another scraping and another procedure, because you don't have any information to work with. So this is what I try to do in my practice and in my work, to give people information.
And how does diet affect their hormones?
Well, poor diet is destructive to everything, because when you eat, for example, a whole lot of fats or lipids, the hormonal system is not designed to know what to do with that. So things sometimes get haywire, and again, people panic and wonder why. But our bodies were not designed to throw all these greasy stuff and these oils and fats in it. The body doesn't know what to do with it. So that's why proper nutrition, which is kind of obvious, vegetables, good protein, is very important.
And and how would you say does thyroid imbalance affect women? Can it be associated with infertility or chronic fatigue?
Yeah, thyroid disease. Thyroid is another very powerful structure. It's an organ that sits right in the neck, in the middle of the neck. And it produces different hormones. It produces one hormone, we just call it T3, one T4, calcitonin. And what this does, it actually directs the organs, the ovaries, and the different, the endometrial lining and all that, as to how to function. So you find that a woman may come in with abnormal bleeding, irritability, fatigue, loss of weight, sudden loss of weight, which can all affect her menstrual cycle. And sometimes it can be easily treated. Sometimes it can be really deleterious for the woman.
In the chat room, G asked, do you recommend bioidentical hormone replacement? I'm familiar with it. I have never used it. Based on what I know, it seems quite logical, but I don't like to address things with which I'm not extremely familiar. But I have known people who are quite satisfied with it, but I really can't speak on it. And Esther said, good afternoon, Selwyn and Dr. Martin. Doc.
Good afternoon.
Doc, what would you suggest in the place of HRT for a female who has had a total hysterectomy to get rid of all the scary and uncomfortable symptoms?
If this is somebody who doesn't want to use hormone replacement, I'm presuming that's what she's saying. She doesn't want to use estrogens. Again, diet change is very important. There are certain products out there which seem to be very helpful. You have, evening primrose, and in my practice, I carry quite a line of products. I find that the Don Kui root, which is a Chinese herbal root, seem to be very helpful. And there's another combination that I have, which have been very effective with my patient. Being a gynecologist, I have found that a lot of my patients are very conscious, so A lot of them do not want the estrogen replacement, and so I try to find options for them. I try to encourage them how to eat or refer them to a nutritionist, and I introduce some of the herbs I have, and I introduce other things. There's certain soy products out there. Changing your diet is key. Moisturizing your body by drinking a lot of water. Moisturizing the outside skin is one thing, but drinking water is the best way to moisturize your body. And you'll find that makes a big difference when you do those things.
Mm-hmm. How can a woman recognize she has a thyroid imbalance?
Well, unfortunately, a lot of doctors or clinics, because of the insurance problem, they do not order thyroid profile routinely. Actually, I do, and the insurance have not really fought me on that yet. But I screen my patients sometimes once a year, once every 2 years for thyroid function. And sometimes I pick something up very early. Most of the time when you wait for symptoms, it means the problem is a little far gone. But the basic symptoms, if you find your heart is kind of beating irregularly, sometimes you can actually feel it beating in your chest, or just any weight loss, or there's a difference in your eyes, they're bulging or they're not the same. Your vision, because sometimes just a change in the structure of the eye can cause little vision disturbances. That's the time to run to the doctor and just check it out and see what's going on. It's a very simple blood test, and you can get all your information within a matter of a day or two.
This weather has been quite unpredictable. We're having, temperature fluctuations and so on. But do seasonal changes affect hormonal balance?
Yeah, to some extent, it does. Temperature change can definitely, as I said, there are some structures in the brain, like the pineal gland, which is one of those glands that's very sensitive to weather change, light change, and so on. So change in the weather can definitely create problems. A lot of people during the winter time, when the heat is on, they may or may not be aware that the heat is actually sucking out moisture from their bodies. So that's one way. Not because it's cold, you should always keep drinking the water.
Dr. Martin, you're also an acupuncturist and practitioner of Eastern medicine. How do you use that in your practice?
Well, as I mentioned before, I do Chinese herbal medicine, I do acupuncture, and I'm a gynecologist. I apply those disciplines in my practice, and I've been doing acupuncture for about 20 years now, so I've kind of developed an art of combining the two disciplines of Western and Eastern medicine. And I find that there are a lot of endocrinological, hormonal problems that I've helped using acupuncture and also herbal medicine. It's a great privilege to be able to combine the two medical disciplines, because it gives me that nice fluidity where I can say to myself, what am I trying to do? I'm trying to help this person. I'm not focusing on their disease as much as I'm focusing on getting them result. So because of that, I reach for things I may have learned years ago will just come back to me as to how to handle this particular situation. And it's been very, very satisfying.
What do you say to patients who are averse to Chinese medicine or to acupuncture, especially if you realize that you can really help them with that?
Oh, I get that a lot. We live in a Western society, and people are brought up going to their doctors. It's kind of a strange thing, and the system doesn't, indulge people to try anything else. Fortunately, there are some hospitals that do embrace acupuncture and so on, but it's very, very few and far between.
Mm-hmm.
And so a lot of people, because they're so programmed to Western medicine, which is a wonderful thing because I'm in it, but it's just lack of information and lack of knowledge, because if people really got a chance to find out how acupuncture works, or even watch it work, or talk to somebody who has had it done, then they'll get a better perspective and not just be saying, oh, I don't want to take this thing, we don't know what it is. I'm going to keep taking my doctor's medicine, which is fine. But if the doctor's medicine is not helping you, and you have, qualified people who are practicing another art of medicine, why not try it?
Wanted to ask, do insurance companies cover the costs associated with acupuncture?
A lot of them do now.
Mm-hmm.
A lot of the big insurances do, because I think with time they found out how much it helps them. Because if a patient is having pain and she needs hip surgery or knee surgery, which is going to be hundreds of thousands of dollars, and here come acupuncture, which is a few dollars, can help, the insurance will happily pay. And that's what they've been doing. Blue Cross, Aetna, Cigna, a lot of the United Healthcare, a lot of them, you'd be surprised so many of them have embraced acupuncture now.
Is there a success story you have, Dr. Martin, where you used acupuncture to help a woman or help heal a woman that had some kind of a gynecological issue?
Oh, I have many, many stories. I could pick one. I had a situation that was many years ago where a woman had fibroids, and I'm not promoting this now, but it was very amazing to me. There were two patients actually, and I was treating her in the meantime with acupuncture and herbal medicine because she was scared of the surgery. Mm-hmm. And when she made up her mind and came to have the surgery, I decided to repeat the sonogram. Good thing I did, because the fibroids were gone. But that's unusual for fibroids. But there are other things which are more common, like pelvic pain, mm-hmm. The severe pain of endometriosis. Oh goodness, it's so many. I treat a lot of people with non-gynecologic pain also, mm-hmm. And I've had amazing results with them. I've treated people with post-op, cancer patients who prognosis were terrible, and I treated them, and somehow they're still alive and they're doing well without any further mishap. I have one woman, she's going on 18 years now, and she's still alive. When she was told 18 years ago, she was placed in hospice, which you probably know where hospice is, where you go when it's the end of your life. And she was placed in hospice. And actually she lives in Maryland. She used to come up and get treatment and so on. But there are a lot of them following because acupuncture works extremely well. If you go to China, you see the amazing things they do there.
Dr. Martin, what is the most prevalent health risk for women today, or one of the great health risks for women today, middle-aged women?
You mean women like in their 40s and 50s and
yes.
Approaching them? I think hypertension is one of the big problems, because a lot of women are so stressed. And again, a lot of them don't eat well. They eat a lot of salty stuff, and that's really wreaking havoc. Mm-hmm. And the other thing, which I hope people have gotten wise to the craziness of smoking, but cigarette smoking is really an unfortunate disaster, mm-hmm. Which is so curable, because all you have to do is try to stop. But I think hypertension and diabetes have been really wreaking havoc on women these days.
And Dr. Martin, women that a lot of women suffer from fibroids and so on. Do you? What has been your experience in treating that situation, that condition?
I mean, fibroid uterus.
Yes.
Well, that's where most of my work, my career has leaned towards fibroid. I've done a lot of that work. And, you know, when I just started out, I remember when a woman has fibroids, she's a certain age, the treatment has to be a hysterectomy and so on. And over the years, I kind of developed my own craft, my own art of taking care of fibroids, because I don't think these women have to all have hysterectomies, even if they have had children. Who am I to say that the uterus was only designed to have children? I mean, 100 years from now, we may hear something different. In fact, there are other functions of the uterus anyway. But to take out somebody's uterus because they're 35 and they have had 3 children, I think that's hideous. So I've done a lot of what we call myomectomy, which is when you remove. What is happening?
I don't know. I just saw. Somebody just joined. Our next guest. Go ahead, Dr. Martin.
Oh, I see. Yeah, the myomectomy is when you actually go into the uterus, you know, it's an abdominal incision, or it depends, you know, you can do it vaginally too, depending on the position of the fibroids. And I've done hundreds of those. I've gone into the abdomen and, you know, try to do nice incisions because women like their bellies to look nice. And go in and I remove those fibroids very diligently and reconstruct the uterus so that if this woman wants to have a child, because a lot of women, very young women in their 20s and 30s have fibroids. So you have to be very futuristic in your planning when you operate on these women. Because if a woman wants to have a child, you can't be just cutting the uterus any old way. You have to be very meticulous as to how you reconstruct the uterus. And so, as I said, I've done a lot of this work, and it has gotten a lot of great results. And so, in my experience now, having done this for so many years, I can say you don't have to remove these uteruses. All these people that have been doing that over the years, maybe something was not too right about that.
Wanted to said, great conversation. Have you used acupuncture to treat cancer patients?
Well, you know, in the business of medicine, you can't really lay too much claim because everybody's body is so different. But yes, I've treated quite a few cancer patients because when people have cancer, they have different things that are happening to them. They could be depressed. They could be having pain. They could be going through their chemo. They could be going through radiation. And so there's a lot you can do on the side as an acupuncturist to bring some relief. And so I've done quite a bit of that. And I mentioned that lady before, and I have a few others that is, you know, has been cancer-free. And in fact, the funny story is that her doctor got an acupuncturist in his practice in Maryland who is now doing acupuncture on some of his patients.
Dr. Martin, how can people reach you?
Oh, my office is in
practice, yeah.
My office is in Manhattan, and I can be reached at the office number 212-213-5811, or they can reach me on my website, which is www.drmonicacmartin.com. One word.
So yeah, 212-213-5811 is the phone number.
Is the phone number.
The website is drmonicacmartin.com.
Yes, doctor with a DR.
Yes, drmonicacmartin.com. Dr. Martin, we have a few minutes more, and is there a particular story or something you would like to tell women about their bodies, about as it relates to their hormonal system?
Um, well, I like to quote the scriptures because it has so much wisdom in it. It says in the Psalms, I am fearfully and wonderfully made. And so in this day and age, that will translate to awesome, which is the word everybody uses. So because you have this amazing, awesome body, you should try to take care of it so that down the road, you won't be hit with all the catastrophes that come with not caring for your body for 30, 40 years. Even if you take care of your body, catastrophes can still come, but your job is to try to minimize that possibility and give yourself a more comfortable life in your older years. So it starts with how you eat. It starts with doing some exercises, and it starts with being conscious and not being really slave to your taste buds. Because the taste buds, if you go by your taste buds and what it likes, then you're giving control. So you can still eat delicious food that's healthy. And so that's my message. Eat well and don't smoke.
And don't smoke.
Yes.
Well, I want to say, I must say that I have been one of the beneficiaries of your acupuncture, and it has
Yes.
done great work for me. So I would encourage anybody to seek you out. The phone number again is 212-213-5811. And Dr. Martin, thank you. I hope you will join us again and to talk about some health matters, because I think our community needs this. And I just
Sure.
want to say that you're not Guyanese, you're Jamaican, and
Yes, I'm Jamaican.
you're Jamaican, and we are very good friends. And so I really appreciate you taking the time out to do this, Dr. Martin.
Oh, I appreciate you too. And like I say, I'm very proud of the work you're doing. Keep it up. And God bless you.
Thank you, Dr. Martin. So I'll take a
Okay.
short break while you get a chance to disconnect, and I'll start the other show just now. So good night, Dr.
Thank
Martin.
Thank you and good night.
All right, bye-bye.